Hi, I'm Dr. Roadhouse, and I want to introduce my patient, Durwood Hendricks. Durwood came in, and I'm going to let him, tell what his symptoms were, but he had a problem ongoing, and went and got a MRI, and he had 3 bulging discs in his lower back. And why don't you just tell everybody about how it was, the pain,
Right.
how you're doing, sleeping, all that stuff.
Okay, for a while there, I had, didn't have any strength in my right leg for sure, and to get any pain where you could sleep at night took about 4 or 5 Advils before you go to bed at night, and even biofreeze on to rub it down biofreeze to get some relief off of it. And as treatment started with spinal decompression, and it kind of eased off, and we got out. To begin with, we were hobbling around on a broomstick for a while. Actually, came in on an actual broomstick, and then we had a cane, and then we'd get around the house on a walker and in and out of the house in a wheelchair, and came in here. Girls had to meet us out in the front and bring us in a wheelchair.
Yeah.
Just and
The pain was so bad, and he had no strength in his leg, that to get around he had to use assistance. And so when he pulled up front, they contact my staff. My staff would get a wheelchair out there, get him in the wheelchair, bring him in. We'd have to wheel him right up to the decompression table, help you get on the table and stuff.
Right.
And after about a month, then we're able to get you out of the wheelchair, and you're on a walker. And the walker was still, you needed it, but it was mostly for stability, because you never knew when the leg was going to give out.
That's true.
Right. And the pain, describe the pain for. I mean, did it just come and go? Was it an ache? Was it sharp pain?
It was just an ache in my right leg, really, mainly my right leg. And to begin with, I'd fall because my right leg didn't have any strength in it, and I always had to put pressure on my left leg. Getting in and out of a car, you had to sit down first and in the seat, and then drag your legs in, because you couldn't stand with your right foot and put your body weight on it.
Yeah.
Yeah.
You had to be real comforting, and your wife wouldn't let you drive either.
No, I couldn't drive, that's for sure.
Yeah, you didn't have the strength to.
Because I couldn't move my foot around from the gas pedal to the brake pedal and know for sure it was going to happen.
Yeah. And it took a while for Loretta to let you drive again. But,
yeah.
Okay, so as it started progressing, the pain did better. The pain in the hip did better.
Right.
And you start getting strength back in your legs. So we got you to the point where you're on the walker, and then that was within a month we got you out of the wheelchair. About the second month, walker.
Right.
Then we got you to a cane, and then for the last 3 months, you've been able to walk without it.
Oh yeah.
The leg pain is gone.
Yeah.
You're able to sleep at night.
Sleep.
Okay. You're able to drive now, because you're
Right.
here by yourself today.
Right.
And the last thing that we're working on right now is just getting the strength back in his legs. He's got the strength, but there's certain movements, like going from sitting to standing, that it's just not strong enough. The leg doesn't give out anymore, right?
That's true.
Yeah, so we're working on that to get him strengthened. So we've got him on the ATM2, which is our rehab machine. We just started that a little bit ago.
Yeah.
And a little early yet to see if you had any results on that yet, but eventually we're in the strengthening phase. And what happened was that he had 3 discs in his lower back that affect these nerves like that. And the research shows just the weight of a dime, that much pressure on the nerve, you only get 40% maximum nerve supply here. So that's why, it's kind of hard for some doctors to understand that he's got a problem in his back, but his leg is the one that's actually giving him, most of the trouble. And so we've got the disc back in now, and the pressure's off the nerve. It's just those muscles haven't had the nerve supply, the same amount as on the right as it is on the left for 6 or 7 months now.
Right.
So that's what we're working on right now. But otherwise, feeling great. The main thing right now is just getting your strength back, be able to go from sitting to standing, right?
Right.
Yeah. How about getting in and out of the car?
Yeah, that's no problem now.
Okay.
I can get in. When you get in the left-hand side of the car, the driver's side, you're putting your pressure on your left foot in the first place. But I've also been able to, on the passenger side, to put my right foot down and step over like you normally would,
Right.
without
Because when this first happened,
Yeah.
one time you went to get in the car.
One time I put my pressure on the right foot and I found myself on my knees on the driveway.
Right. So, yeah. So that, I mean, just from, you know, when you think about the pressure on the nerve, you don't realize how much it can affect you in every phase of your life. And you were having a hard time sleeping, and so you're tired all the time, and you just weren't feeling good. So I know that you know, you went to the other doctors, and you know what the outcome, if you'd gone down that road, was.
Oh yeah, man. If we just had to come here and done spinal decompressions and surgery was the only answer, you know, that that would have been terrible. Really
Yeah.
would have been.
Well, and you're doing good, and I know that it wasn't cheap, but you know how you feel about your progress, and whether you'd recommend it to someone else.
Oh yeah. I think that considering that surgery is not the answer in the first place, then I think it's something somebody ought to do if they
Okay.
can. You know.
Okay. Well, anyway, what we're going to work on now is just get you strong, okay, and then we should be finished up with that pretty soon, and you'll be able to have full use of your leg. You're going to be strong and have confidence that you can move around and not have any problems with it.
Right.
Okay, we'll check in with you in a little bit later after we get you all strong, okay?
Okay.
All right, thanks, Derwood.